towards clinical studies. I'm excited to announce that we received a breakthrough device designation from the FDA in July, thanks to the hard work.
The Food and Drug Administration, or FDA, which authorizes clinical trials for medicines and medical devices, has recently designated Elon Musk's Neuralink N1 device as a breakthrough device. In short, do you grasp the significance of this? Human trials are now set to begin. Elon Musk has successfully tested his Neuralink N1 device on pigs and rhesus macaques, a species of monkey closely related to humans in terms of DNA. By the end of 2022, he plans to start human trials. Once these human trials are successful, patients will be able to walk into any hospital where a surgical robot will implant the Neuralink N1 in their brain. After just an hour of fully automated surgery, without anesthesia or post-surgical bleeding, the patient will be ready to go home. And no, this isn't science fiction. It's going to be a reality soon. Imagine you're moving a cursor on a computer screen. This action generates electrical activity in your brain, specifically in the primary motor cortex or M1 region. Now consider transmitting this electrical activity to another person using a smart device. That's essentially what a brain-computer interface, or BCI, does. The Neuralink N1 is a type of BCI. Neuralink is designed to telepathically transmit the brain's electrical signals. To grasp Neuralink's function, you need a basic understanding of how your brain operates. Our brain contains at least 100 billion neurons. Each neuron consists of three main parts. First, dendrites, which receive chemical signals from neighboring neurons as neurotransmitters. Second, the soma, which interprets these chemical signals and converts them into electrical signals or impulses. Finally, the axon relays these electrical impulses to the dendrites of the next neuron through gaps called synapses. This electrochemical activity occurs even during simple tasks. The activity varies, being less in some regions and more active in others, depending on the task. So, where does Neuralink come into play? As a brain-computer interface, Neuralink studies these electrical patterns. It then translates a person's thoughts into data that a computer can understand. Currently, in the realm of neuroprosthetics, UTARA and synchronous neuro-EP have already advanced to the human trial phase. But the pressing question is, why are people still eagerly awaiting the Neuralink N1? Well, in UTARA, a chip with 100 rigid needle electrodes is implanted in the patient's brain. These wires then exit the skull and connect to an external computer system to interpret the signals. In essence, it is a completely impractical design for everyday use by any patient. To address this issue, Synchron introduced a more compact device with its NeuroEP, but it too has its own limitations. The microelectrodes of NeuroEP do not penetrate the brain like needles. Instead, they are placed in the blood vessels surrounding the brain like heart stents, from where a small recorder in the chest wirelessly transmits signals to a computer or smartphone. This is indeed a unique approach in this field, but can you spot the major fundamental issue here? Synchron's stent rods don't directly contact the brain tissue, which means decreased accuracy in signal identification and interpretation. Imagine, while multitasking, the patient might pick up the robotic arm of the pen and start trying to write on the pen instead of the book. You never know. For greater accuracy, microelectrodes need to be placed right beside the neurons, just like in Neuralink. In Neuralink's case, its microelectrodes are notably flexible. On Neuralink's official site, it's clearly stated that before moving to clinical trials on healthy animals, they first conducted trials on cadavers, meaning deceased animals, and then on terminal animals that were near the end of their lives. This allowed them to refine the surgical procedure using dead animals and improve the actual device with the help of terminal animals. So, what went wrong with Neuralink? A controversy erupted over alleged animal cruelty. Consequently, despite receiving the FDA breakthrough device designation, The approval for human trials is still pending, even though the device surpasses its competitors. According to Neuralink's official website, their future prospects extend beyond enabling communication for paralyzed patients. They aim to cure mental health issues using Neuralink technology. One of their key goals is to develop a mechanism that can trigger motor neurons in the hands and feet of paralyzed patients by interpreting brain signals through Neuralink. This vision aligns with Musk's overarching philosophy. SpaceX's senior executive and former NASA astronaut Garrett Reisman recently shared in a podcast that Musk operates on two main philosophies. First, everything he does should have a practical application. Second, any tech he develops should contribute to creating a self-sustaining colony on Mars. Now, consider this. If you examine Musk's major achievements, all the dots connect. For instance, why did Musk establish SpaceX? Clearly to create an affordable mode of transport between Earth and Mars. But why invest in electric cars? Simple, because fossil fuels are scarce on Mars, but the sun shines on both planets. And why is Starlink developing a satellite-based internet system? Because satellites are more efficient, practical, and affordable than mobile towers. They provide excellent coverage over vast areas. So in this context, what do you think? Is Neuralink N1 just for addressing mental health issues? Or is Neuralink an extension of Starlink, enabling telepathic communication? On Mars or any unstable planet, this could prevent panic and conflict. Communication would become exponentially more effective. Cooperation among species would significantly increase. This advantage would greatly aid human proliferation on any planet. So, isn't this a very futuristic step? What do you think about that, guys? Share your thoughts in the comments below. If you found this video informative, please hit the like button. Subscribe to the Mindful Journey channel and press the bell icon so you won't miss any of our future videos. As always, stay curious, keep learning, and keep growing. Bye.